No. I can't hear anything.
Down there at the bottom.
There's that for us. We're gonna have to unmute this one.
Yeah. So everybody that's on, can you hear us now?
I can hear you now.
Same here.
Good deal.
Yes.
I can see and hear.
Good. So everybody that's on, can you hear us now?
Yes.
I can hear you now. Yes.
Yes.
I can see and hear.
Good. Everybody that's on, can you hear us now?
Yes.
I can hear you now. Yes.
Yes.
Yeah.
You all getting a lot of feedback?
Yes, a little bit.
Like somebody doing one of those chimes that you run around and around and around. Yep, I'm getting that.
I thought it was Doppler. Sounds like a sonar.
It does sound like.
Oh,
Yes, a little
Are you
bit.
in a submarine? Is that how you're safely distancing?
like somebody doing one of those chimes that you run around and around and around. Yep, I'm getting that.
Thought it was Doppler. Sounds like a sonar.
It does sound
Oh,
like. Are you in a submarine? Is that how you're safely distancing?
yeah, I'm getting that.
Thought it was Doppler. Sounds like a sonar.
It does sound like. Are you in a submarine? Is that how you're safely distancing?
So, Marty probably needs to say, don't unmute yourself, but when you want to say something.
Hear me now.
Stop.
We're unmuted now, so.
Good evening, everybody, and welcome to the September 14th,
Hear me now.
2020 Board of Health meeting. At this time, I'll call our meeting to order. For attendance purposes, since we're meeting remotely, guys, I'll call out your first name. So if you will state your first and last name and that you're present. Good evening, everybody. and welcome
Courtney?
to the
Courtney Austin Wilson, present.
2020 Board of Health meeting. Robert, time I'll call our meeting to order.
Robert Brown, present.
Mary Ann,
Mary Ann Evans, present.
Carrie,
Carrie Hampton, present.
Hope,
Hope Haywood, present.
Julie, Julie,
Julie May, present.
okay, thank you. Ryan,
Ryan Snipes, present.
Mac,
Max Semi, present.
Amy,
Amy Williams, present.
and I'm Marty Trotter, and I'm present. So thank you, guys. Moving on down the agenda, there were no public comments at this time, so we'll take the next item, which is the approval of the minutes for July 13th, 2020. Those were sent out in your packet, so hopefully you've had a time to review those. If there's no questions, is there a motion to approve the minutes as presented?
I move to approve the minutes as presented.
All right.
Robert Brown.
Do you have a second?
I second the motion, Courtney Austin Wilson.
Okay, Courtney. Now what, guys, I'll need to do is go through the list again, state your first and last name, and signify by saying aye. So Courtney?
Aye. Oh, Courtney Austin Wilson, aye.
Robert?
Robert Brown, aye.
Mary Ann?
Mary Ann Evans, aye.
Carrie?
Carrie Hampton, aye.
Hope?
Hope Haywood, aye.
Julie?
Julie May, aye.
Ryan?
Ryan Snipes, aye.
Mac?
Max Semi, aye.
Amy?
Amy Williams, aye.
And I, Marty Trotter, vote aye as well. So thank you. Motion carries. Next item on the agenda is the fiscal year end for 2019-2020 financial review. And that'll be taken care of by Susan Hayes, our director.
So good evening, everyone. I appreciate you all being here. You should have gotten in your packet ahead of time the financial budget review. I will go over the page that says finance revenues first. So you can see that in the first column, we've put in there what we budgeted for the year. And this is fiscal year end 2019-20. And then the next column shows what our actual revenues were for that year. And in most of our revenue streams, we did fairly well, some better than others, and some we hadn't expected. With dental health, that came in at about 56% of what we budgeted. But if you'll notice right below that, our dental health Medicaid settlement, we actually got 226% of what we expected. So we did really well there. So that made up our difference, I think. When you see, like, let me find one. 1, 2, 3, fourth row down, CC4C, we got 98% of the Medicaid funds we expected. But right below that, you see the escrow appropriated funds. Escrow, Medicaid has to be spent, Medicaid earnings have to be spent in the programs that we earn them in. And we are required by the state to have a certain amount of funds held back in reserve in case we have a problem down the road. We had thought going into this past year in 2019-20 that we might have to pull $40,000 out of our escrow or our savings account to meet our budgeted requirement. And if you can see, we did not. So we did not have to appropriate any revenues from our escrow account for our community care coordination for children program. And you'll see on down near the bottom, the same thing for our pregnancy care management program. These are both case management programs. And again, we have to spend the money we earn in those programs. And we had estimated going into this year that we would need to appropriate $51,000 in our pregnancy care management program. And we only had to appropriate 6%. So our savings account was not hit as hard as we had thought it might be. So we did well there. So we came in at about 86% of our estimated revenues needed, which is good because if you look at the next page, which would be our expenditures, they balance. We kept our expenditures down to meet our revenues. And so while we had a approved budget of $6,631,349, we were 86% under budget for our expenditures. If you look back at the first page, you can see in the pie chart that 44% of our revenues are provided by the county. So Randolph County government funds 44% of our programs. Most of that goes into health education. It also goes into our general clinic for communicable disease. And a lot of it goes in environmental health, for example, is 100% funded by the county. So that's where that 44% is. And then on that second page with the expenditures, you can see where the funds go by program, what portion of our budget by program. So environmental health funds is about 73% of our budget, roughly. The expenditures were that much of our budget. So any questions about that?
Susan, there at the very bottom of revenues, the county revenue, we only spent 76, or we only received 76%. Is that stating that 24% is the savings to the county?
Yes.
Because we didn't spend all of our budget as originally approved?
Yes.
So that's a savings to our
It
county
is a
and
savings
taxpayers.
to the county and to the taxpayers. Thank you for pointing that out, Marty. And we work really hard to do that. We work very hard to find funding in other places so we can save our county taxpayers as much money as possible. So the next page I'll go over with you is our North Carolina debt set-off. We can participate in the debt set-off program, and you've got a running list there showing what our collection rate was. And for this year, it was $13,000, which it was more than that last year. My guess is that is, and how we do that is if you haven't paid your bill for quite some time, and right now I don't remember the policy, so I apologize. We can send your collections to the debt set-off program, the North Carolina debt set-off program. And if you get a tax return or a lottery winning, then we're one of the folks that gets paid first out of that pot. Just like Randolph County Tax Department does the same thing. So that's how much we earned through debt set off. And then you can also see our accounts receivable by program and by year. It has varied quite a bit over the years. In some years, we've done quite a bit better than we have in other years. And I honestly think last year was hit pretty hard by the impact of coronavirus, because a lot of folks either were out of work, you know, for whatever reason, they weren't able to pay their bill. And so I think we see the evidence of that here. All in all, though, we were able to collect $72,000 of our accounts receivable, which was more than the 2 previous years. Any questions on either of those? Okay, where's my agenda? And then the very last piece, and I need a motion on this that I have to show you. And this is our bad debt write-offs. And what we're requesting is to write off $3,302.34. Bad debts are debts that we cannot collect. The person has died. For whatever reason, it's uncollectible funds. We cannot collect that money. It's not money that we have an opportunity to collect anywhere down the line. So we're asking for approval to write off $3,302.
Okay, you've heard the report from Susan Hayes. Do I have a motion to approve the bad debt write-off in the amount of $3,302.34?
I, Robert Brown, approve. Make that motion.
All right, I've got a motion from Robert. Do I hear a second?
I, Carrie Hampton, second.
Okay, we have a motion and a second. Any discussion? Okay, at this time, I'll call each name and then you'll signify your vote. Courtney?
I, Courtney Alston Wilson.
Robert?
Robert Brown, aye.
Mary Ann?
Mary Ann Evans, I.
Carrie?
Carrie Hampton, I.
Hope?
Hope Haywood, aye.
Julie?
Julie Mabe, aye.
Ryan?
Ryan Snipes, aye.
Mac?
Mac Semi, aye.
Amy?
Amy Williams, aye.
And Marty Trotter? Aye. So motion carries. Thank you. This time we'll go back to Susan Hayes for the Health Director's report.
Susan, can I ask one question?
Yes.
If a person, can an individual that owes debt, can they still receive services if they're not allowed to pay, if they're not able to pay their debt?
Absolutely.
And is that continuous or is that a certain cutoff point for an individual?
We work with people. We say, what do you think you can pay? If they can pay us $1.
Okay, that's what I thought. Okay,
That,
thank
but
you.
Yes, they can. Okay, so my health director's report, I'm gonna start out by telling you that I am more than coronavirus. We have had unprecedented issues going on in the health department. I don't remember this ever happening in my 32 years of being here. We've had 12 vacancies since the beginning of January. Those vacancies are, there's great news about them. I just don't remember that ever happening. I requested 3 new positions in the new year, in the 2020-21 budget year, and the commissioners approved those 3 positions in our budget. So we have hired a new assistant accounting specialist. Her name is Sharon Inman. We've hired a new bilingual health educator. Her name is Amara Savilas. And we have also hired a new physician extender. Her name is Ashley Wilson. Those are 3 new positions that the county commissioners approved with our budget, and we're excited about those positions. They have all started with the exception of Ashley Wilson. We think her start date will be around November 1st. Then we've had 6 retirements since, wait a minute, let me count that again. 1, 2, 3, 4, 5, 6, 7. Excuse me, I'm 7. I went back 2 or 3 times on this to try and make sure that it was right. So from our staff, we've had 7 people retire since January. We've had 3 processing assistants retire, and we filled those with Joanna Robertson, Jennifer Bird, and Yesenia Senez. Not sure I said that right. We've had an interpreter retire, and we now have Maria James Losa. We've had a billing clerk retire that we reclassified that position to a community education and outreach support specialist. This person is Melissa Thompson. She will be assisting the health education team, and we will also share her expertise with our wellness coordinator, Sam Barner. We've had a public health nurse retire, and Crystal Spivey is our new, she will be sharing communicable disease. She's been in, she started in February, she started February 1st, and we sent her to the Emergency Operations Center on March 17th. So she's been in the EOC with us since she started almost. And then our WIC director retired, and we replaced her with her assistant, Jody Meyer. We have had 1 vacancy due to a promotion, and that's another nurse that was hired. Her name is Melissa Toller. And then we've had 1 vacancy due to resignation. So I think out of 12 positions, 1 vacancy due to resignation is pretty darn good. Those 7 retirements within 6 months' time is a lot. And we just hired Christy Allred. She is a registered environmental health specialist with Alamance County. This is unheard of. We never get fully qualified environmental health specialists, but we did this time. So we're very excited about that. That's great news. And Tara and I will be, I don't know what we're going to do to learn all these new people because we're not in this. So we'll have to quiz each other on who's doing what and what their names are when we finally get back over here. But we've got a great team still, and we're real excited about all these new staff members. The other good news is our dental health program just received a Blue Cross Blue Shield Duke Endowment grant of $65,000. And if you noticed in our revenues, in that revenue report, our revenues out of grants this past year were $127,149.40. Every year since 2016, we have gone up and up and up in the amount of money we get from grants. And I'm extremely proud of that because that was one of my goals when I became health director. I'm exceptionally proud of this Duke Endowment Blue Cross Blue Shield grant because it's very competitive. The first year is a technical assistance grant. And if we are invited after the first year, we can apply for 2 successive years of grant money. And our goal is to provide oral, it's aimed at school-based oral health. So we hope we get it so we can continue providing dental health services to children, but especially in the school setting. So that's exciting. And I have to give kudos to our dentist, Dr. Mustafa, who is phenomenal. She is energetic. She loves Randolph County, and she is all about our dental program. So we're really proud of her. She's got a great team as well. North Carolina Medicaid, those of you who are new won't remember this, but if you're old and been around a little while, and I don't mean old in age, but if you've been around a little bit, you'll remember last year we were talking about Medicaid reform. Well, that is back on the docket now. So we have been told that that will pick up again in 2021 and that we need to be ready. We currently have contracts signed with Blue Cross Blue Shield, WellCare, America, AmeriHealth, Caritas, but we do not have, the only one we do not have yet is United Healthcare. We don't have a contract with them yet, but that is because we engaged a law firm back in the beginning when we started all this, because these contracts are like, 40 pages. And Amy Scott and I felt like it was necessary to have somebody who was well versed in healthcare contracts to help us look at this. And so United Healthcare could not get their situation acceptable for our law firm last fall before coronavirus hit. So I've been back in contact with our attorneys, and they are telling me that we should be seeing a new version of this United Healthcare contract soon. And once we see that and Amy agrees and the attorneys agree, they won't send it to us until they agree. Then we'll sign that one and we'll have contracts with all of our providers for Medicaid, not Medicaid reform, but Medicaid reform. It will be managed care Medicaid is essentially what it is. So any questions about that? I'm expecting to hear more and more about that the closer the legislature gets to making all this happen, and North Carolina DHHS gets closer to making all this happen. So we'll see. Other good news that I have is if you remember, if you've been around a little while, I've been talking about our caseload with WIC and how WIC caseload had kind of been hit a little bit. Well, we served over our caseload in the past 6 months. And so we received a new increased caseload. We went from 3,062 to 3,187 participants. And we will receive an additional $16,500. So our WIC program team is doing a great job. We've seen that our participants actually like participating virtually, which they're able to do right now. I'm not sure they'll get to continue to do that beyond November, but hopefully they will until this pandemic crisis is over. We'll see. So that's good news. September 17th will mark our 6th month of being in the Emergency Operations Center. We opened our Public Health Operations Center on March 4th. We continue to do all the things that we've been doing at that time, and we're getting pretty good at a lot of it. I think last time I sort of discussed with y'all how we're organized and how we've made certain individuals on our team points of contact for, nursing homes, the hospital, business community, the jail, detention center, schools, camps, daycares. We've covered every point that we can think of, community events, all those things. Somebody is a point of contact for all those things. Our data today was, when we left the EOC, we were at 2,608 total cases for the 6 months. We have 65 probable cases. And I don't know that we talked about that last time. Confirmed cases, that 2,608 cases are absolute positives. They have had a DNA test, a test that looks for coronavirus DNA called a PCR. And we know without a doubt those individuals are positive for coronavirus. The 65 probable cases across Randolph County now, a lot of our urgent cares are doing, and probably in Greensboro and Guilford County and other counties as well, are doing antigen testing. Antigen tests look for protein, pieces of protein from the coronavirus. And they are most effective around day 5 in the incubation period of coronavirus. They can miss some positive cases, about 20%. And so when we get those antigen tests, CDC and the Department of Public Health for North Carolina will not allow us to categorize those as absolute positives. They are probable cases, not positive cases. So we've had 65 of those. Now, we treat those just like positive cases. So nothing is different other than the way we categorize them. Right now, we have only 2 outbreaks with our nursing homes, which is great. That is Alpine Health and Rehab and Universal Healthcare. Universal got out of their outbreak. They had one right at the beginning, and they got out of it, and were out of it for several weeks, and now they've got 2 cases again. So I'll remind you that when a nursing home has 2 positive cases, whether that be in a staff member or in a resident, that is considered an outbreak in a nursing home. And then community clusters, we had gotten up to about 13, I think, if I'm remembering right, community clusters. A community cluster is a community place.
It could be a business.
Yeah, it's not place it where I want, but it could be a business, it could be a church, it could be a school, it could be any situation where there are a lot of people. That's not a congregate living setting. Only nursing homes and detention centers fall under that 2 cases and are considered outbreaks. When we have a cluster, that's 5 positive cases that we can epidemiologically link to each other. So we could have, for example, 10 cases in an industry, but we could say, because they can tell us exactly where they got it from, and we know it was not from anybody else within that industry, that's not a cluster. But if we had a case in an industry and we know that one case affected 4 more cases, that's a cluster because they're linked. They're epidemiologically linked. We have 2 of those now, Technomark and Hughes Furniture. So we've gone down, and I want to say, this is another one of those things about our team. I want to call them my team, but they're the county's team, but they're my team too, at the Emergency Operations Center. We would not be seeing this if we didn't have the best team of folk working public health in North Carolina right now. We went from 13 clusters in Randolph County. We have 2. And we'll get those down if we're just given a little bit more time. Our nursing homes went from about 4 at one time. We've got 2. So our team is doing an absolute fantastic job, and it's the kind of hard work that it takes to make this happen. They work round the clock, a lot of them. So I really appreciate what they do. So that's where we are with our data. Any questions about that? Okay. I did want to mention funding because there has been a lot of pots of coronavirus CARES Act funding coming down to public health. We early on got about $65,752 to spend. However, would help us the most at the time, and that was way early when we got that pot of money. Then we got another 54,110 early this summer, but we could only spend that money on testing. Then we got just recently $242,557, and we can only spend that money on testing. And today we just sent in an agreement to the state for $177,244,000. That money can be spent on testing, but it can also be spent on other infection prevention costs. So we have not, some of it may be spent on testing, and then some of it we will see where we need to spend that money based on the agreement addenda and the infection prevention issues they have targeted for spending. So altogether since March, I guess, we've gotten $539,663 $1,000 towards coronavirus mitigation. And a good portion of that has gone toward testing. I'm going to let Tara come in just a minute because she is my testing guru. And she works with Sam Varner on this because it is a big deal, and we have to really reach out and connect with our community to do that. So they've sort of teamed up on that, but I'm going to let her do that piece of information in just a minute. I also want to tell you about vaccines. I figured you all would have some questions. I know not a lot, but I will tell you what I know about them. What I understand is that the CDC has been telling the State Department of Public Health since end of August, early September, to expect limited vaccine availability in early November. And I think you probably have heard that on the news already. Our understanding is that there are 2 vaccine possibilities. One vaccine has a cold chain requirement of -180 degrees Celsius. If that is the vaccine that gets sent out, it will come straight from the manufacturer because otherwise it can't be maintained at that low temperature otherwise. It will come in special containers that can hold it for 5 days at that temperature. And it will also have the ability for us to add dry ice if we should receive that vaccine and if Randolph County receives any. North Carolina does not have a say in which vaccine they get or how much vaccine they get. CDC does. They call the shots. The state is working with CDC right now to determine what the priority groups will be in North Carolina. My guess it will be those folks that are most needed, healthcare workers, first responders, and those individuals that are most at risk of death and severe illness. But we'll see. That's what I would expect to see. All of our providers, every provider in the United States and in North Carolina will be expected to enroll in the vaccine program. So we should be seeing, Dr. Brown, we should be seeing something from the state saying here, health departments will have to do that as well. It's time to enroll in the coronavirus vaccine program. There will be required reporting if you take vaccine. And that reporting will also include certain data points that must be included in that information. And then all ancillary supplies except for gloves and sharp containers will be provided with the vaccine. Apparently, and I don't really know the details, but apparently, and I was here during H1N1, there was some problem about sharps containers, so they are not including those in our situation this time. So any questions about that?
Are they still planning on doing the pocket form of the vaccine? Pocket injection?
I don't know. I do not know. I'm sorry.
For those of you who don't know what that is, rather than getting a vial that you would draw up from. Medication is automatically dispensed into a pocket. The pocket is attached to a needle already. You stick the needle in the person, you squeeze the pocket, you pull out, you're done.
Yeah. I know that in the past, we've gotten pre-filled syringes for a lot of different things. I have not heard anything about the pocket vaccine, so I don't know. The only other thing I'm going to share, and then I'm going to turn it over to Tara, and that will be the end of our report, is we asked the county for money from their CARES Act money for a media campaign. And we have got that going. There's been a number of social media things done. I don't do social media, so I'm probably not going to be the best one to tell you about that. But I do know there are ways to boost what we say and do, and there's ways to advertise our messages through social media. So you may have seen some of those things. If you go to our website or go on our website, you should be able to see some of that. But we've also invested in some billboards. We do have some up already. There's one right here on South Fayetteville Street across from the BP station. And then up north of town near Northgate Shopping Center on Vision Drive, there's one. But I've asked Ernie if he could share those with you so you can see what they look like. Doesn't matter, you just go for it.
You want to scroll through?
These are in English and Spanish. So I hope that you'll see these. There's about 13 locations across the county where you will hopefully see these throughout Randolph County. Thank you. So that's all I have. Is there any questions that you have for me before I turn it over to Tara?
Got a quick question about vaccinations. How are you doing on starting your flu vaccines?
Well, we still haven't gotten our vaccine.
Okay.
So there you go. I know providers have theirs. I know pharmacies have theirs. But it's amazing to me that public health doesn't have their flu vaccine. So we don't. We do have a little bit sent to us from the state for children through the Vaccines for Children program. But the vaccine that we actually ordered, the private vaccine we ordered and paid for, we have not received yet. And they just keep telling us it's coming, it's coming. So I don't know.
Yeah, the reason I brought that up, we are starting to see a few positive flu tests, but incidentally, if they have a flu test, we're also doing the COVID test. The flu tests that have come up positive 2 or 3 days later, come back positive for COVID.
Oh, okay.
So I don't know whether they're actually having both infections or one test is interfering with the other.
Could be, and those flu tests are the same antigen kind of tests.
Yes.
That
Yep.
COVID tests are, and they can produce false negatives. So there may be something going on there. I'll, if I can, I'll send that question up to the state and we'll see if they've heard anything related to that.
Great. Thank you.
Yeah.
Susan,
I'm sorry.
I had a couple of questions.
Yes.
How are the schools done so far in Randolph County with reopening? I know Wheatmore had a case last week, so I was just wondering how have they been doing with that?
Randolph County schools are doing well. Now, you've probably heard that they've sent home a lot of folks. I talked to Dr. Gainey multiple times a day, probably anywhere from 8 to 10 times a day. He's calling to report to us when parents call them and say that they've got a positive child or that they're themselves are positive or whatever. We call him to let him know when we get a case that tells us, well, my child goes to Trinity High School or to Wheatmore. Then he and his team look to see if that child has been in contact with anyone who's in their classroom, if it's a staff member, what classes they've been in, what staff members they've been around. And to be quite honestly, we're actually sending home more people probably than is 100% necessary.
Mhm.
He and I both, and I have consulted with the state and we're following their guidance. They have told us it is far better to err on the side of caution than not. So
Okay.
we are being extremely cautious about that. So families that have not heard from his staff personally or have not heard from my staff personally, if their child was sent home, can be assured they don't really have to worry, but they were in that group that we felt like we just wanted to make sure they were safe.
Okay.
We are seeing an increase in positives in the Archdale Trinity area. We have Jared Bird, EMS, is in our EAC every day. Got Donovan Davis, the chief of emergency management, emergency services, and Jared Bird, his deputy director in our EOC every day. Jared assists us with creating heat maps so that we can look at where our hot spots are in Randolph County. And we can clearly see in the beginning, it sort of was centered around Ashboro. It has shifted now toward the Archdale Trinity area. Archdale Trinity is very populous, just like Ashboro City. It's our second most populated cities in our county. It is a very diverse population. We have multiple cultures in the Archdale Trinity area. And economically, it's diverse. So I think that's a lot of what we're seeing going on up there. But the schools, going back to your question, they've done an outstanding job and they are being as cautious as they can possibly be to make sure students and staff are as safe as possible.
What economic group in Archdale has the most cases right now?
We're seeing a lot of Hispanics. We're seeing a lot of Urdu population, but we're also seeing a lot of non-Hispanic and just, Caucasian, American, folks.
Yes.
So we're seeing just a smattering of all. We just have, when you have multicultural populations, their cultures are different. How they interact with each other is different. And so it does impact what happens in that community when we're looking at communicable disease.
But you say Americans. That's what I was asking. What Americans in particular?
That wasn't a good word to use.
Because I didn't know what you meant by that.
Non-Hispanic is what I mean. We're seeing non-Hispanic and we're seeing Hispanic and we're seeing our Urdu population as well in that part of the county. Urdu are Asian, Indian.
I'm aware. Okay.
What else? Okay, I'm going to let Tara talk to you about testing.
Good evening, everybody. Like Susan said, I'm going to give you guys an update on testing. At our last meeting, I was expressing to you guys that we were working on trying to make arrangements for the detention center to be able to offer testing to incoming inmates. I think we were in the process, if we hadn't already, presented to the Randolph County Crisis Management Team the request to use some of the county's CARES Act money to be able to test incoming inmates at the detention center. And the Crisis Management Team approved that. So beginning in late July, the detention center partnered with Mako Medical. Mako Medical provides testing supplies and the shipping items needed. And the detention center medical provider, Medico, actually collects the specimens. So in late July, the detention center started collecting specimens on incoming inmates. And since that time, they have tested around 327 incoming inmates, and 7 of those have tested positive. So let me explain a little bit about what they do. So when an inmate is being booked in, Medico, a staff member of Medico, tests that inmate, and that inmate is placed in a special holding area. They may be held with others, but they're held with others that are just incoming. And they're held there for 3 or 4 days until the test results come back. So they know the test results before those incoming inmates are ever introduced into the general population. That being so, to date, so far, no positive COVID-19 cases have been introduced into the general population at the Randolph County Detention Center. We always give props to Randolph County Detention Center because they have done a really, really good job at keeping COVID out of that facility. And by them offering this testing, they're doing something that we haven't heard of any other detention center doing this type of testing. So we just have to give them props. They're working really hard and doing a good job. So wanted to give you guys an update on that. Since we last met, Randolph County Public Health, we have started offering COVID-19 diagnostic testing free to the public on Friday mornings from 7 a.m. to 11 a.m. We started out by offering 25. We wanted to see how that would go, and we filled all of those slots on our first day. So we bumped it up to 50 on the last 3 Fridays. And on the last 3 Fridays, we've had, I think 48 one day, 37 on another, and maybe 47. So we've tested about 155 individuals, and 17 of those have come back positive. So those have gone very well, and we plan to continue offering those for the foreseeable future on Fridays. We're advertising that on social media. So if you guys want to share that, please feel free to do so. Get the word out there that it's a free event on Fridays, 7 a.m. to 11 a.m. We ask folks to pre-register, but if they show up and we have slots available, we're going to get them enrolled and get them tested.
Tara,
Yes.
your Friday morning testing, are those individuals who are symptomatic, or what's the criteria?
Anybody that wants to be tested.
Just if they're curious.
Curious, if they have symptoms, we're not excluding anybody.
Okay.
Yeah, we're actually doing a lot of testing on people who want to travel, but they can't travel to another state unless they have a negative test in hand. So a lot of our tests are actually going to travel. So like she said, it's kind of open to everybody.
Also, since we last met, Randolph County Public Health has partnered with StarMed Healthcare. They're a company that provides COVID-19 diagnostic testing. And we've hosted 4 drive-through community events with StarMed. We looked at areas, marginalized populations, and we looked at areas that had lots of cases. So they were hot spots. So we took the testing to those areas. We provided a testing event at Kiwanis Park on August 19th, and we had 42 people tested. On August 20th, we took testing to Richland Village Mobile Home Park because we had a lot of cases there. Unfortunately, only 11 people showed up for that event. On August 25th, we held an event at Crestview Wesleyan Church where we tested 40 people. And then on August 26th, we had an event at Northgate Commons where 47 were tested. So total of those 4 events, we've tested 140 people. We are working with we continue to work with StarMed, and we have a 5th event scheduled for this Wednesday from 4 p.m. to 7 p.m. at the Archdale Trinity Chamber in Archdale. We're hoping that some of the folks, since we are seeing increased numbers up there, we're hoping that folks will take advantage of that event and come through the drive-through testing event.
Can you say the time of that again, if you don't mind, Tara?
Yeah, sure. It's from 4 p.m. to 7 p.m.
And that's this Saturday?
Wednesday. And information should be on our Facebook page and probably on our website. So if you guys would share that, that would be great.
Have Tara,
Yes.
have you guys been able to accommodate communities that have requested testing? Like if somebody has said, can you come into, this area of the county, this, this populated area and do testing for the people here?
I don't know that we've really had anybody make that specific request, but my next piece to talk about is that the Department of Health and Human Services has partnered with StarMed to expand testing across the state of North Carolina. They selected 7 counties. They were looking at numbers, where counties that were having an increase in cases, looking at marginalized populations, that kind of thing. And Randolph County was selected as one of those counties. So as Susan mentioned earlier, Sam Barner and I are working on this project. We have reached out to municipalities. We've reached out to some community partners. We've reached out to some of our industries that have had large numbers of cases to gauge their interest on whether or not they would like to have StarMed come and offer testing. So far, we heard back from, there are several events actually already scheduled. One of our community partners, Gene Woodall with Our Daily Bread Soup Kitchen, they're holding a testing event tomorrow from 10:30 a.m. to 1:30 p.m. Another one of our partners, Elworth Cheek with Mount Nebo Holiness Church in Ramseur, they've got an event scheduled for this Saturday. The City of Trinity, they've scheduled an event for next Tuesday, September 22nd from 4 p.m. to 7 p.m. Clyde Faust, another community partner, Sam has worked closely with him, and they've scheduled a testing event at the George Washington Carver Education Center on October 3rd from 4 p.m. to 6 p.m. We've also worked with the Grubb Family Y in Trinity, the City of Archdale, and the town of Seagrove, and we're just waiting to hear back to get those events scheduled. They have expressed interest in holding events. We've reached out to 4 of our industries that have had a lot of cases, and at some point they've all been in a cluster. We've reached out to Hughes Furniture, United Furniture. They quickly responded and said they were not interested at all. Technomark and Klausner were also contacted, and they both expressed interest. They had just a little bit of hesitation, simply because StarMed, they bill people with insurance, they bill the insurance, and both Klausner and Technomark are self-insured, so that was going to cost them money. And I don't want to put off on them like they don't want to spend money on their employees, because both of these industries have gone above and beyond to slow the spread and keep COVID out of their places of business. So like Susan said, we've gotten several pots of money, and some of those pots of money are specific for testing. So we have offered to assist both Technomark and Klausner, since they're interested, in helping pay for a portion of their employees to be tested. So that has gotten them on board with making a go of pursuing this testing. So Sam and I will continue working with them to get their events scheduled. I think that's all that I have for testing. I'll be happy to answer any questions if anybody has any.
Thank you, Tara, and thank you, Susan, for your reports. Any other discussion before we have a motion to adjourn? Okay, guys, I really appreciate you being on the meeting remotely, and hopefully one day soon we can all get back together in this room and be together as a group. But for right now, we're doing what we have to do remotely. So I do appreciate your time this evening. At this point, do I hear a motion to adjourn the meeting?
I, Robert Brown, so move to adjourn the meeting.
Okay, do I hear a second?
I hope he would second.
All right. And we'll call your name if you'll signify by saying aye. Courtney?
Aye.
Robert?
Robert Brown, aye.
Mary Ann?
Aye.
Carrie?
Carrie Hampton, I.
Hope?
Hope Haywood, aye.
Julie?
Julie Mabe, aye.
Ryan?
Ryan Snipes, aye.
Mac?
Max Semi, aye.
Amy?
Amy Williams, aye.
And Marty Trotter, aye. Thanks again for your time tonight, guys.
Thank
Everybody
you.
have a good week. Thank you.
Everybody
You all
be
stay
safe. There.
We say the same thing, Robert.
Bye, guys.
Bye.
Bye.
Bye.